So John had to attend another appointment this afternoon, so we're his substitutions. John's the director of the SHIPP, and Tara is in her second day with us at Bristol City Council, and she will be joining John as a co-director of the SHIPP. So I work in Bristol City Council as a public health principal for sexual health, and so I've been doing some support around the SHIPP while we were waiting for Tara to join us. We've split the presentation so that I'll talk a bit about the work that we've been doing, and then Tara will talk about what we're hoping to do in the future and give us some reflections on the HIT. So the SHIPP is really similar to many other HITs. It's a broad partnership between people with a stake in sexual health improvement, and you have got shared ambitions and an agreed vision of how to achieve them. It covers the BNSSG footprint, so we have members from across the 3 local authorities. We have other commissioners, including the CCG, who commission termination of pregnancy services. We also have our providers, so we have the NHS trusts and voluntary sector organisations, and we also want to strive to include more patient voice in the SHIPP in the future. So our model is really to assess and prioritise the needs, and then to use that to advise on evidence-based commissioning, and to ensure also that we're providing good value for money, which is very topical at the moment, and obviously where there are evidence gaps, working together to try and facilitate research to fill those gaps. We have about 6 work streams in the SHIPP, and here are just a few examples of projects which different work streams have been working on. So they range from projects which work in primary care, trying to strengthen our approach to managing sexually transmitted infections, particularly in this case chlamydia and gonorrhea, and looking at how we can improve partner notification for that. We also have a work stream which looks at better screening in sexual health services for intimate partner violence, and over the next year we hope to expand that into other settings such as pharmacies. We have a work stream looking at improving diagnosis of HIV. We've also done a lot of work this year to do a comprehensive needs assessment of sexual health in Bristol, and we were very beneficial to have support from the SHIPP in terms of providing us with access to local data that we wouldn't otherwise have, and that's being used to inform the reprocurement of sexual health services, which we're currently undertaking at the moment. We've also had some really good work looking specifically at improving health outcomes for sex workers in the city, and we also have a separate work stream which really focuses on how to evaluate patient and public involvement in our sexual health services. So we thought today it would be good to exemplify the work of our HIT by talking about the work stream on reducing late diagnosis of HIV, because we feel that it's really the partnership and collaboration through the HIT that has made the work possible. So currently our diagnosed prevalence rate of HIV in Bristol is 2.07 per 1,000 population, which means that we have just gone over the threshold according to BEVA guidance where we need to increase access to HIV testing. As you can see, it's rising and it's similar to the national average. And what's very concerning is that still a significant proportion of the people who are diagnosed with HIV are diagnosed at a late stage of infection. So currently in Bristol that's 44.7%. And the reason why we're really concerned about that is because late diagnosis is associated with much poorer outcomes in terms of increased mortality and morbidity for the individual, but also from a population perspective, it's also associated with increased HIV transmission rates. And so really this work stream came about because there was a big piece of work a couple of years ago which looked at some of the very late HIV diagnoses across the southwest. So actually it was focused in Bristol as well as Bournemouth and Poole, and they used a particular technique of serious incident audit to look at those cases. And what came out of that audit was the fact that there were really, particularly in Bristol, missed opportunities for diagnosing HIV in primary care. So as you can see, this is something which has just been published in the Journal of Public Health this year. But really that was the catalyst to the work stream wanting to do something to improve testing in primary care. So, so we've been working together to implement 3 different interventions. The first one has been training. So we've identified the 20 highest prevalence practices in Bristol, and we've gone into those practices and delivered training to all the clinicians in the practice to make sure that they really have knowledge of what the clinical indicators are for HIV, but also to address some of the barriers that they might face in terms of offering HIV tests to their patients. So that's been really well received, and we're currently evaluating that. And we're doing that both through qualitative research with the University of Bristol, as well as looking at HIV testing rates. So we're looking at quantitative data provided by PHE Lab. So following from the training, and as I said, we've just reached that point where we need to increase our HIV testing. So we're running a pilot in the 6 highest prevalence practices to offer HIV tests to all adults who are registering in the practice, and we want to try and target that at the highest risk groups. So whereas in other parts of the country with very high prevalence, all newly registered patients are offered the test, in our kind of moderate prevalence city, we're thinking in order to most effectively use the resources, we're going to try and offer the test to everybody, but particularly suggest if you're from a high-risk group to have the test. So that's something that we're rolling out in 2 practices over the coming months, and then another 4 practices will hopefully come on board over the next 6 months or so. And then finally, we are developing a risk prediction logarithm tool, which is something which our statisticians from the work stream from the University of Bristol are really working on. And really the idea is that it will help primary care clinicians to flag when an HIV test might be appropriate. So it's really just encouraging them to think HIV test. So as I said, we felt that this was a really good example of the HIT working in partnership. And so this slide is really trying to show all the different people who've been involved in the work stream over the last year or so, and people have come in and out of the work stream as the work has changed, and it's really been held together by Margaret May and Charlotte Davies from the University of Bristol, who are quantitative researchers, but they've really given the overall coordination and kept that momentum going in the group, as well as providing us with access to data which we would have otherwise had to have paid a lot of money for, the CPRD data, as well as advising us on how to evaluate the interventions. And then there's us at Bristol City Council. So we actually commission sexual health services. The majority of sexual health services, again, as you've heard from many presentations today, there is a split in commissioning responsibilities, and sexual health is no different. But in this case, when it comes to offering an HIV screen in primary care, that is our responsibility. So we were able to fund the intervention. And if it's feasible, then it might be something that we can make a case to expand in the future. And I think the other thing that we've done as commissioners is really acted as gatekeepers into the practices, which might not have happened otherwise. We've also had really good support from clinicians. So we've had a registrar from Bristol Sexual Health Service who's actually developed and delivered the training. And we've had Mark Gompels, who's the consultant lead at the HIV treatment service in Southmead. So there's been a lot of partnership, and we just felt that it was a really good example of a project where actually there wasn't a huge research grant, but by people pooling their resources and having a shared vision, we have managed to achieve something together. So I'm going to hand over to Tara, who's going to talk about our future plans. Okay, sorry.
That's all right. I'm not going to speak for very long because most of you have heard this before. So really, I'm Tara Raj. My role is City Council and also jointly funded by Public Health England. So I'm interested in sexual health issues, but also from a HIT point of view, looking to the future, not just about the diseases, but some of the more upstream factors that affect sexual health and relationships and those sorts of things. So going forward, it'd be really important to review what we're doing in line with the Joint Strategic Needs Assessment and also the Sexual Health Needs Assessment that's just been done. The re-procurement of the sexual health services is exercising my colleagues greatly, and that's across the whole footprint of the BNSSG, is that the right terminology? So once that's done, I think there'll be a real opportunity to identify some of the emerging research gaps and how to plug them. And it's great that we've got academics and we're trying to recruit community members as well to the group in order to refresh it. So there'll be a stakeholder engagement workshop towards the end of the year. I won't go through these discussion points, but what I was very mindful of is we do have this opportunity for the Sustainability and Transformation Plan, and I'd be quite surprised if sexual health didn't feature in that. So what I'll be doing is going from here to find out where the links are. Thank you.